Welcome to our third live Facebook Live event. My name is Hiten Patel, and I'm a Chief Resident in Family Medicine at Ohio State, as well as an MPH student here at Ohio State in the College of Public Health. I'm very excited today to chat with everyone about an important topic for me, and I think for everyone, of misinformation in our area of COVID now, and how to get important and accurate information. My goal today is for everyone to go away knowing where and how to find information, how to avoid misinformation. So just an overview, I'll spend about 5 to 7 minutes in the beginning talking about a few things, and then we'll have the rest of the time for question and answer. So first, I'll start with a few examples on misinformation and the impact that it has. And I'll talk a little bit about a couple tips I have on how to avoid misinformation, and then I'll end with the sources that I like to use that are reliable and accurate. Throughout the presentation, please use the chat window and ask questions that you have, and then we'll also have a couple poll questions that pop up throughout. And at the end, we'll post a little summary about what I talk about, as well as a couple of the resources that I like to use. So let me begin with a quote from the World Health Organization Director General Tedros Adhanom, who said that, quote, "Fake news spreads faster and more easily than the virus and is more dangerous." So I think that's a very strong statement, and I wanted to back it up with 3 specific examples and use these examples to show how dangerous misinformation can be. So I'm going to add the first poll question here. So there was recent news that NSAIDs should be avoided in coronavirus patients. This initially started with a journal article in the journal article Lancet, where they proposed a theory that perhaps NSAIDs, some biochemical pathway, may worsen COVID. They didn't say that COVID and NSAIDs should be avoided. NSAIDs should be avoided in COVID, but they just recommended that it should be studied more. However, this information was picked up by multiple media outlets and eventually the French health ministry, who recommended not taking NSAIDs. And this news spread really, really quickly and went all the way up to the World Health Organization, who actually recommended avoiding NSAIDs. And then the following day, the World Health Organization actually retracted that statement and said that there's no evidence not to use NSAIDs. So this just illustrates how quickly information can be misinterpreted and then also spread. So one thing can be said, it can be misinterpreted as something else, and that can be spread really quickly throughout the news outlet. And so great job, kind of a split there in terms of the poll. So the second example I wanted to use was about hydroxychloroquine and COVID. And so there's been a lot of information out there about hydroxychloroquine being a treatment for coronavirus. And this really started from 2 small non-randomized studies that were published from France. One study was about 30 people and another study was about 80 people. Neither was a randomized trial, and I can go into the details, but I will briefly just say both studies were very biased and they had very low quality. Now, I'm not saying hydroxychloroquine doesn't work. I'm actually very optimistic about it. And actually, there was a study published in the last 2 days that is showing some better evidence. But unfortunately, this information was taken by, again, multiple media outlets, politicians throughout the world, and it was spread. And the danger of this was twofold. So one part that was really unfortunate is that people read this, and a couple people, and there's a couple in Arizona who took chloroquine and actually died. They took a fishbowl cleaner form of chloroquine. So that's one issue, is that misinformation can lead to inappropriate consumption of drugs and death. But secondly, that because there was a lot of news on it, some healthcare providers actually self-prescribed hydroxychloroquine, leading to a shortage. And so the danger in misinformation from this example is that it can lead to deaths if people inappropriately consume a substance, or it can lead to shortages in this actual substance itself. So good job there on the poll. Maybe there's not enough evidence out there yet to say one way or another. The third example I want to use is about local here, is about news circulating last week that Governor DeWine was going to stop the sale of alcohol. And this was actually pretty widespread, and there was some videos that actually showed this. So this was unfortunately false and fake news. And the danger of this is that it could have led people in a mass influx to go to grocery stores. And even if one person was sick, it could have made multiple other people sick, and it could have worsened our social distancing policies, and people could have gotten sick. So that's the danger in circulating false news, is that it can essentially dysregulate and break away everything that we've done in terms of flattening the curve. So hopefully those 3 examples provide a little bit of background on why it's so important to avoid misinformation. So I want to give you six tips on how to avoid misinformation, and then we'll talk a little bit about specific sources. So my first tip is to only consume information from reliable resources. So we'll talk a little bit about specific resources that I like to use, but try to avoid using resources that you can't really point to or websites that you've never seen before. My second tip is to favor print news as a reliable form over any videos or television. And the reason I say this is because you can actually fact check, and people actually fact check print news. There's links in these articles that you can go to make sure that the information you're seeing is accurate. The third tip is to, if a claim is made in any type of news article or media outlet, go directly to the published research. So for example, if you're reading an article, reputable articles should have a link specifically in the article that goes directly to the research. Tip 4 is to be very weary of any claims that are about cures, treatments, and the origin of the virus. And so I'm really happy to see this poll result here pop up. So there's been some false news circulating that coronavirus is a bioweapon, and that is unfortunately not true based on research, and it just leads to more hate around the world. So it's really important to be aware of claims that are made and not to fall prey to those. Number 5 is to be a detective before you share, especially. So if you read something that's interesting and you want to share it with either friends or family or on Facebook, Twitter, do a quick Google search, spend a couple minutes to make sure that what you're reading is accurate, and then spread it. What we don't want is articles to go quote unquote viral, so that way it spreads and it leads to misinformation. And then tip 6 is, if a story sounds fake, don't click on it, don't engage with it, because if you do click on it, that will only lead the algorithms to promote that article even higher, so more people will be exposed to it. And so the last part of what I want to talk about is where to get relevant information and good sources. So in terms of basic information about coronavirus, a couple resources that I like. So I will post and talk about the Ohio State Wexner Medical Center website on coronavirus. We also have a Twitter page, a blog, and our Facebook page that posts a lot of articles and videos that our physicians and our healthcare providers are posting. The Ohio Department of Health coronavirus website is also fantastic, and it gives figures and tracking of how coronavirus cases are going in Ohio. And then, of course, the CDC and the World Health Organization are two fantastic sources of how we should take care of ourselves, but also take care of others. And they're also posting data. The World Health Organization actually has briefings that they're posting as well. In terms of news for Ohio, I highly recommend watching Dr. Acton and Governor DeWine's daily COVID updates at 2 o'clock. You can watch them online, on Facebook Live, on TV. I think it's the best source of providing information on coronavirus, but also what the government is doing in terms of economic stimulus. The Columbus Dispatch is a good print source that I go to for information, especially being in Columbus here. It's a good source. In terms of national news, NPR is my go-to because it tends to be the least biased and it tends to be the most factual. They also have an audio podcast that you can listen to if you're on the go or if you're running. Aside from that, the New York Times, the Washington Post, and the Wall Street Journal are also three very good sources, and they tend to be moderate, slightly leaning one way or the other, but they tend to provide up-to-date information. And then for a little bit more perspective and longer pieces on kind of the social impact, I like going to The Atlantic and Vox, VOX. Those two tend to provide slightly longer articles and more perspective pieces. In terms of world news, I love going to the BBC World News website, not only because they provide information on Europe and the United States, but they tend to do a good job at providing information on what's going on in Asia and Africa as well. And then the Economist podcast does a good job at providing information on the impacts of COVID on the economy, but also on social welfare and the well-being of people around the world. The website itself is fantastic, but it's a paid subscription service. So I like just listening to the podcast, which you can get on Apple or Google Play. In terms of data trackers, I highly recommend the Johns Hopkins Tracker, where you can go to see the number of cases and deaths throughout the world, but also within the United States. And a new one that's coming out that I haven't completely been able to confirm the data on is healthdata.org. Again, that's healthdata.org. And this website does a good job at showing kind of projections as to how many cases will happen both in the US, but in individual states. And then it shows the resources that we have in each state. So how many hospital beds, how many ventilators will be needed, and will there be a shortage? There's a couple individuals that I follow on Twitter that I highly recommend, and I'll just read through them real quickly. Dr. Tom Frieden, he's a former director of the CDC, and he's been posting a lot of information on data and trends that we expect to see. Along with that, Atul Gawande is a surgeon in Massachusetts and a famous writer. He's also the CEO of a conglomeration called Haven, which is a healthcare policy company. He's been tweeting a lot and writing a lot in the New Yorker about coronavirus and its impact on healthcare and healthcare workers. And then Ashish K. Jha, Jha, is a public health expert at Harvard. I'd follow him, as well as the Harvard Chan School of Public Health on Twitter. And then finally, Bill Gates has been touting and talking about public health crises for the last decade or so, and specifically about coronavirus over the last few years. And he's been writing a few good articles about the impact and how we can mitigate the risk in coronavirus. If you're interested in medical journals specifically, I'd recommend, and interested in reading them, I'd recommend JAMA, JAMA, NEJM, which is the New England Journal of Medicine, or Lancet. So that's all I had, and I'm going to go through these questions here that you guys have, so feel free to add any questions, and we'll chat a little bit. So there's a question here that is asking about discussing the sensitivity of testing and what the false negative rate is. So that's a good question, and I'll try to answer it the best I can. So what we know about testing is that every specific test is a little bit different. So the test that Abbott is developing and then that Patel developed can be slightly different from the tests that are used in our state health laboratories. But studies and predictions are showing that it could be anywhere from 60 to 75%, 75+%. So that's the sensitivity, meaning if a test is done, it's not necessarily accuracy, and I won't go too much into the details. So it is good, but it's not completely accurate. And what's good is these test accuracies are increasing, but also repeat testing can be helpful in confirming that. So a couple questions on specific examples if you have a condition. So if I would definitely discuss this with your doctor if you have a specific question on medications and that pertains to you. A question on if we know rapid testing will become available here in Columbus. I expect that it will. The time frame is challenging. Again, Patel and Ohio State are working on that, and so is Abbott. So hopefully, as the governor said yesterday, within a couple of weeks we'll have that, and that will be a big difference because it will save personal protective equipment. So for example, if someone is admitted to the hospital and we have an answer of whether or not they have coronavirus within an hour, then we can avoid using up PPE for that, as opposed to if the test takes a couple days to come back. So another question about if diabetics are at higher risk, and it's hard to say one way or another with the data. We're still getting more and more data, but there is some evidence that they are at higher risk. We just don't know how much of a higher risk they're at. So any chronic conditions such as diabetes, high blood pressure, smoking, COPD, you're at slightly higher risks of getting severely ill, but we just don't know how much higher. And there's another question about testing people for antibodies. Again, this is something that's in development for a lot of labs. And the importance of this is if we do know that someone is immune to the infection or if they've gotten the infection, then certainly we could potentially put this person back in the workforce, or they're not going to get infected again. We don't know yet whether or not someone can get infected twice. Most people are hopeful that this isn't the case and thinking that this isn't the case, but we just don't know enough yet. So hopefully we do start testing antibodies soon. But again, I think the biggest focus right now is on testing for coronavirus itself. So there's a question on if we really need to wipe down groceries, packages, etc. This is a great question. I would direct you to the Harvard Chan School of Public Health, who has a great article on groceries and kind of how careful we have to be with groceries. So they say in their article that in an ideal world, that would be something that we could do, but in reality, the amount of resources that it requires to wipe down our groceries or takeout or anything else that we're bringing into our home is just so challenging, and they actually don't recommend that, but they do recommend cooking things thoroughly to make sure if there is anything, even not only coronavirus, but other bacteria that you can avoid that. So a question on if you're more susceptible for COVID if you have an autoimmune condition. The answer is correct. That actually goes up if you're on an immunosuppressive medication, such as Humira or chronic steroids, things like that. A question on healthcare providers in the outpatient setting wearing masks for routine patient care. I think we'll find out more on this over the next couple days. The CDC yesterday just came out saying that they think somewhere around 20% of people are asymptomatic carriers, and they're reassessing whether or not healthcare providers or people in general should wear masks, not to protect us, but more so for us to spread the virus if you don't have any symptoms. Some questions here on blood types being at increased risk. I don't know enough about that to speak to it, so we'll have to look into it a little bit. I just haven't read anything about that yet, so we'll try to look into that. And we'll go through a couple more questions here. So a question on the chance of someone with asthma surviving. Similar to what we discussed earlier with chronic conditions, we just don't have enough information to make a prediction in terms of 10% chance, 20% chance. People are at slightly higher risk. The reason is because if you have any chronic lung condition, then your lungs aren't as resilient to take any stressor. And so any type of stress on the lungs will increase the risk. We just don't know how much. I will say if you're well controlled, you're probably at a slightly better chance of doing well. And then a couple more questions here. So one report states that the virus can remain on cardboard for up to 24 hours, other surface such as stainless steel for 3 days. So yeah, that is great. That's actually coming from a study. And so there was a study done, and it was in vitro, meaning that it was done in a very controlled environment. It wasn't in the real world where they placed parts of viruses on different surfaces such as aluminum and cardboard. And in that study, it was on certain surfaces for up to 3 days. I think that is important to consider. What we don't know is if it is on a surface, if we don't know if it can infect someone. We also don't know how it will be in the real world. So in a controlled environment, certainly it can be up there for 3 days, but in a real world environment, there's a lot of interactions, a lot of changes on certain surfaces. Things are being cleaned, so we just don't know if that applies in the real world. But that is a study that was published last week. And one more here. So a question about why they don't show how many people have it in each area. So that's a good question. It'd be great if we had live, up-to-date, accurate data for every part of Ohio, and we do to a certain degree, and throughout the world. But the way we collect data and the way it's kind of aggregated and placed on these larger Johns Hopkins trackers, it's just delayed a little bit. And then also the way we track things between hospitals is delayed just a couple days. So I mean, I would love to see accurate, up to date, minute by minute trackers. And I think we've made a big difference in terms of how much data we have, how quickly now compared to even 10 years ago. But I think we're making progress towards getting data really quickly, and that's allowing us to make decisions on both the state level and the federal level. So I'm going to end it here. Feel free to keep asking questions, and we'll try to respond to it throughout the day here. And we'll post a little bit of information specifically on the sources that I discussed, and also on a little bit of what we discussed in the beginning.